On the 8th of June 2017, the United Kingdom had its general election, called to bring a sense of clarity and authority over the Brexit negotiations. Of course it did no such thing. Brexit amounts to a new order of uncertainty for public services. I want to examine Northern Ireland, and in particular the NHS, police and local government. When do contingency plans need to be in place? When do actual resource committing decisions need to be made? Will budget allocations reflect needs? Is there going to be a Brexit window of opportunity to address long-term problems? All public services face the general funding uncertainty that goes with Brexit. Will this add years to the already lengthy period of austerity, or free up resources? There are also specific sector issues. A list of problems faces the NHS and social care sector. Some relate to the future administrative costs of treating temporary residents. There are also the healthcare needs of returning UK citizens in the post-Brexit era to be factored into demand forecasts. Possibly of greater significance are the 3 million EU migrants currently accessing healthcare on the same basis as UK nationals. There's a lack of reliable data on the use of health services by immigrants and visitors, so it's impossible to make a strong estimate of net effects if access is withdrawn. The EU's policy of freedom of movement and mutual recognition of professional clinical qualifications means that many health and social care professionals currently working in the UK are from other EU countries. This includes around 60,000 of the NHS's 1.4 million workforce and about 80,000 of the 1.6 million workers in the care sector. These are estimates, and digging down data relating to individual trusts or care organisations is very hard. For the NHS, the biggest issue under a hard Brexit is the border. Can access to specialist and other care services currently delivered in a cross-border model be continued? The NHS is already struggling to recruit and retain permanent staff. The RCN estimate there are 2,000 nursing vacancies in the NHS and care sector in Northern Ireland. Just how reliant the health and care sector is on citizens of the EU, and in particular the Republic of Ireland, is far from clear. Criminal justice became more closely linked to the EU than was generally realised. Across the UK, a hard Brexit will cause police leaders to address operational practices which involved EU cooperation on arrest warrants and working with Europol and Eurojust. In Northern Ireland, post-Brexit border may require the PSNI to provide major new support to border force and UK visas and immigration. It's clear that given the history of Northern Ireland and its border areas, there are serious threats of political violence and civil disorder to be considered. A softer Brexit eliminates many problems, but there will likely need to be a border police service with associated funding, staffing and training issues. Local authorities in Northern Ireland are exposed to Brexit threats of a general nature, including changing procurement conditions. Brexit may mean adjustments for councils over existing roles, ensuring compliance with regulatory practices in areas that include the environment, building control, bathing waters. There could also be border-related staffing problems, but in Northern Ireland, local authorities are not major players in social care, as is the case in England. Northern Ireland's local authorities have been significant players in the use of European Union funding, including the unique Peace Programme for Northern Ireland and also the Interreg Borders Programme. The sums of money are not particularly large. For example, a typical Northern Ireland local council may receive around 3 million over 7 years in Peace 4. This is not a huge proportion of its budget, let's be clear. But peace funding is attractive, enabling projects that would not otherwise happen. Local authorities have also developed new skills in multi-sector, multi-level partnerships. EU peace funding has a non-monetary value in the sense that it extended their role. This is significant when 80% of your budget is spent on waste management and sport and recreation. While Peace 4 allocations have been guaranteed, it's far from clear if local government can expect similar types of funding in the future. Over a year in from the referendum, there's no real progress towards a public services Brexit Plan B, which might include costings, timetables, legal and technical analysis of sufficient detail to base policy and operational responses if and when needed. Instead, public service leaders are working through uncertainty. There are calculative uncertainties involving risks, likelihoods, outcomes and impacts. There are also likely to be structural uncertainties where leaders can see possibilities but cannot determine the likelihood of occurrence. Many of us, after the political events of the last 2 years, may also anticipate unknowables, events that will be unimaginable in advance of occurrence. We can anticipate leaders will try and extend the period before they need to decide and deliver responses. It's unclear whether central government will tolerate or even encourage such practices. We shouldn't forget the opportunities that may appear over the course of Brexit. For instance, Brexit may push the NHS recruitment problem over the edge. And finally, training a surplus of clinicians rather than relying on EU migrants or rest of the world migrants becomes the accepted policy position. For the PSNI, Brexit and a separately budgeted border police may give them a chance to deal effectively with the historic problem of border crime, possibly in much closer cooperation with the Gardaí. There's also the possibility that Brexit-related demands for documentation provides the impetus to greatly enhance data handling capacity generally. Again, budget will be crucial. For local authorities, the threat of losing EU funding may cause them to become more attuned to producing better evidence of what works in relation to the type of projects associated with Peace 4. In all cases, political support for long-term planning is needed. The closer Brexit runs to deadlines means the greater chance there is for political expediency to dominate decision making.